Okay, so just like before, we need to make sure we have definitions and we're understanding that we're speaking the same language, and then we're going to get the best results out of this education. So let's go into assessments and their definitions and how they relate to the movement screen. So we need to make sure we have the right language. We all know that. So the first one is mobility, which is the ability of a joint to move through a range of motion. It represents the potential for movement within body segments, joint systems, or muscular systems, and the ability to express this through a full physiological range. So physiological range is very, very important. So an elbow may be able to go into hyperextension. That is not physiological range, but it needs to have full extension and full flexion. So a quick way to think about it is mobility is always going to be your movement potential. So more mobility means more movement potential. I don't think I need to elaborate on that too much. So some of the factors influencing mobility are muscle extensibility, which is the ability of a muscle fiber to lengthen sufficiently to achieve a desired range of motion. Connective tissue flexibility, which is the pliability of tendons, ligaments, and joint capsules to permit motion. Joint mechanics, which are the structural and functional behavior of the joint during movement. And nervous system activity, which is the neuromuscular system's role in coordinating and permitting movement. So if we look at this, all these factors, and give you a real life example, muscle extensibility, for example, training for a full range of motion will help with muscle extensibility. If we're doing bicep curls and we miss that bottom position where the arm's fully locked out, we aren't going to get full extensibility of the bicep fibers. So making sure a muscle can do that, pretty important. Connective tissue flexibility, the pliability of tendons, ligaments, and joint capsules. These can be limiting factors in a joint's mobility. So sometimes you may not have a muscular restriction in the hip, you may have a capsular restriction in the hip, stopping you from going into internal and external rotation. With joint mechanics, that's the structure of a joint. So in the hip, if we're going to use that, we could have a femoral head that is really quite large for the socket, and it is either retroverted or anteverted, meaning it's shifted forward or shifted backwards, and that stops that hip going through a normal physiological range of motion due to joint mechanics. And then with nervous system activity, it could be recruitment. So if we look at something like the prone hip extension test, what happens in that one? If we preferentially use our lower back and our hamstrings over our glutes to extend our hips, what happens is the femoral head actually doesn't slide backwards in hip extension, which limits the range of motion because it goes forward and actually comes into a mechanical block. So these four factors, if we just keep these in mind of what's influencing mobility with a particular person, gives us a really good problem-solving framework to work with. Now, flexibility, that's the capacity of soft tissue structures to lengthen adequately, enabling full range of motion at a joint. Osteokinematics is the movement of bones around joints in the body's three planes of movement, which are sagittal, frontal, and transverse. And arthrokinematics is the movement occurring between joint surfaces, such as rolling, sliding, or spinning, which facilitate overall motion. So I will be bringing these up intermittently throughout the course. I just want to make sure that you understand what the words are when I say them, or if you read them in anything else. So we need to make sure we have this right. If we get this right, then we've got happy days. We're going to get everything that we need out of this course. And you're going to be able to use this information to explore far more comprehensive work in rehabilitation to help make you a better coach.